Good morning, Virginia. This is Virginia This Morning.
This segment is sponsored by Stony Point Surgery Center.
Did you know that 80% of us are affected by low back pain at some point in our lives? And that's pain that's not just a nuisance, it can be disabling. Dr. Michael DePalma with Virginia Eye Spine Physicians uses new innovative techniques to treat back pain and joins us this morning. And we'll have some examples too, along with our very good friend Julie Bragg, Community Outreach Director. Welcome to both of you. Thank you for being here.
Good morning.
Good to see you both. Let's talk about this for a second. First of all, I would imagine, kind of like the question everybody asks somebody when they meet them in Richmond, where do you come from? Where does the pain come from?
That's a good question, Bill.
Yeah.
Actually, we've learned from a variety of research that we can identify the source of back pain. In adults like us, the most common source of back pain is a disc, for example. And if I were to borrow a piece of your back and take a look at it here, I have a model which may help illustrate that. But this is a particular bone in your back, the vertebral body, and then one below it here. And in between the two is the disc, the intervertebral disc here. And that is the most common source of back pain in adults our age.
Okay. So, and the disc, what, acts like a shock absorber kind of thing?
Yeah, exactly. The disc can have a variety of functions, but it does take on load as we are active, even sitting here in the seats or we go about our daily activities. And it does act as a cushion in between the bones themselves.
And you can squeeze that, and you were showing me this earlier, actually show what can happen to the disc.
Right, so if I turn this model on its end and we look through this top bone, which is clear, see-through, you see some redness on the back edge of the disc, and those are areas where tears develop in the disc. And quite simply, the tears don't heal completely, and that can be a source of chronic back pain. And what can happen, if I can pull this off, is if I apply some pressure,
right there.
you notice on the back edge,
Squeezing out the
Stuff
back.
is squeezing out the back that's not supposed to.
that's
obviously.
correct, that's a disc herniation.
Okay.
And a disc herniation can then develop or lead to red hot leg pain. And the back pain itself may actually ease up, but then the patient has a lot of sciatica.
Okay.
And that can be disabling as well.
Because the backbone's connected to the leg bone. I'm not going to sing. All right, let's talk about, you have non-operative ways to treat this, obviously, without actually getting in there.
That's correct. My practice specializes in x-ray guided procedures,
Okay.
injections, if you will, for example, of steroid around this disc herniation to reduce inflammation and let the body heal itself. The objective being reduce the patient's symptoms and allow them to get into physical therapy and be able to function better.
And I've seen this in action.
Yeah.
I mean, I went in the procedure room with him, and it's truly amazing. The patients are awake, and obviously they're numb back there. But he has the x-ray machine right there, so Dr. DePalma can put the needle right where he needs it to be and can see right where it is, take an x-ray shot, get it right where it needs to be, do the injection, do whatever he needs to do, and that helps with treating the pain and diagnostically figuring out exactly what's wrong.
So all those years of video games when you were a kid paid off. Because you're actually watching it on a screen, aren't you?
That's correct, yeah.
And so this kind of takes us to the next place I want to go, and that is tomorrow's treatments today, because this all sounds very science fiction almost to those of us who aren't in there like Julie was watching you do this.
Well, the epidurals, for example, have been around for quite some time, but newer technologies, if we get back to our model, this disc here, if you think about a strategic way to treat the tear in the disc, new technologies are being researched and investigated to identify ways to help repair the disc or stimulate repair of the disc. And those are more on the horizon research trials that aren't FDA approved yet, but we're involved in a couple trials looking at some of those new
So
medications.
we're doing that here in our area.
Correct, here in Richmond. That's right.
Real quick, I got about 20 seconds. What kind of common mistakes do we all make all the time that cause back pain?
That's a good question. It's more than just proper lifting and proper posture, but if you think about it schematically in your mind's eye, you want to try to divert any weight that you're engaged in holding through your legs and not your low back. So if you're leaning over a counter, for example, you are shaving in the morning, extend one arm on the counter and lean on your arm rather than leaning forward over at your waist as you're shaving or brushing your teeth or brushing your hair.
Right. Shaving not a big problem for me. Thank you, doctor.
At least
you,
not
Bill.
this morning.
That's why I didn't have back pain today, I guess. Thank you,
good.
sir.
That's
Thank
right.
you, Julie.
Good to see
Appreciate
you.
it. Folks, you can talk to and meet with a specialist like Dr. DePalma and learn a lot more at Virginia Eye Spine Physicians by giving them a call, 804-330-0303, or get information online anytime by visiting vaspine.com. Now,